So, listening to this, I think it might be common for those who had COVID, or you may know somebody who had COVID to have similar symptoms. And I'm going to talk about this a little bit.
I came down with COVID in March of 2020, and it took about 3 weeks for me to get over that initial bout of COVID. And then for about a month, I actually felt like I was getting better. I was doing yoga, I was doing an aerobic exercise plan. But I remember it was a 28-day exercise plan, and on day 26, all of a sudden, it was like someone flipped a switch. My body just could not get through the first 5 minutes of the aerobic exercise. And I remember having to just lay my head down on my kitchen table. The fatigue was crushing. So for me, in the next couple months, the fatigue was really bad. I developed ocular migraine in my left eye. My joints would swell up, and I would also get breathless doing very normal things like walking up the stairs, from the subway. So it was really scary because I thought I was done with COVID, and I realized fairly quickly that these symptoms were persistent. And not only were they persistent, but they were really interfering with my day-to-day activities.
So, many of you know what COVID is. So, let's just review that a little bit. Most of the times when we talk about COVID, we think about somebody having runny nose, fever, having trouble breathing, or sometimes they have headache, and that this is why people go to the hospital for. So you can see, you can have anything from a runny nose, you can have a headache, cough, fatigue, sometimes you have shortness of breath a little bit, or nausea, vomiting. Those are the common ones. But COVID also attacks the other parts of the body. You can have a rash as a skin finding, you can have a heart attack, or you can have chest pain. On top of it, you can have hormone abnormalities. When we talk about the GI symptoms, you can have diarrhea, you can have constipation, you have stomach ache that's severe. Some people cannot eat. You talk about the nerve findings. You have headache. You can't think straight. You don't sleep well. It's like you're in a fog. It's something called a brain fog. And I'll talk about that in a few minutes. You also have issues with blood clots. Some people develop blood clots in their lungs, in their legs. It can go to your brain. It can have complications. There's liver problems, and there are kidney issues. Sometimes people develop kidney failures. These are all part of COVID. So if you are having issues, when is it called a long COVID versus when you have just a COVID? It's basically a timing issue. And if you are still having symptoms where you feel sick, if you can't think straight anymore, or believe it or not, if COVID left you financially hurt, people can't go back to work, their family is destroyed, then all of that could be part of the long COVID. So again, like I said, it's a timing issue. Most of the times, if a patient has COVID, it's within about 4 weeks, people should be okay. And if the symptoms are lasting more than 4 weeks, that's when we start thinking, is this something else? Is this something a prolonged episode? So you can see names here. These are all part of what we call long COVID. Long COVID syndrome, post-COVID syndrome, chronic COVID, myalgic encephalomyelitis, chronic fatigue syndrome, post-exertional malaise, brain fog, and all of that. Why are there so many different names for something? Because it's new and because it affects so many parts of the body. For example, we talked about all. Start with a cough, start with a breathing problem. You talk about difficulty concentrating. You talk about headaches. You talk about sleep problems. People after having a COVID have trouble sleeping for a very long time. This is a map of the US. And as you can see, different parts of the country are affected by COVID. We are in New York. Potentially, there's 1 million to 2 million people are affected by this condition. No part of the country is spared. Everybody's experiencing it. Some are experiencing it more than others. Why does long COVID persist? Well, there are multiple medical, scientific ways of evaluating it, but do know that people who have diabetes or people who have high blood pressure, people who are obese, people who are elderly, or people who have what we call autoimmune diseases. You may know somebody who has lupus. That's one of the type of diseases where this can happen. So I'm going to just shift gear just a little bit to describe why is this so important for this community. This is a data from, This is data from last Monday. Look at the zip code, that's 11203, that's where we are at in Brooklyn. Our population is about 73,000. The cases that we had on that day is 21,000. Number of deaths, number of people vaccinated, you can see the numbers there. But what I want to point out is these numbers. Case rate that's higher than any of the other part of Brooklyn, higher than the New York City numbers. Death rate, higher than other parts of Brooklyn, higher than New York City, entire New York City. Vaccination, lower than other parts of Brooklyn and lower than New York City. So it's almost like we're having a double whammy. More cases, less vaccinated patients. This is positivity rate. That basically says if you tested 100 people, how many people will be considered positive? Look at the New York State number. It's about 6 out of 100 people will be positive for COVID if we tested them. And this is a data from the 21st. That's just 4 days ago. Look at New York City number. It's about 5 out of 100 will be positive. Brooklyn, barely about 3 to 4 people will be positive out of 100. But look at our zip code, 11203, 13.4. That's almost 2 times the New York State number, almost 3 times other parts of Brooklyn. Hospitalization, similar pattern. So why is it such an important disease for this neighborhood, for Brooklyn? Because we have a higher incidence of people living below the poverty line. The unemployment rate is the highest in Brooklyn than almost any other part of the country. Healthcare disparities. You talk about chronic medical condition, it is some of the highest numbers in Brooklyn. Adults living in Brooklyn are more likely to suffer from diabetes than any part of the country. Children in Brooklyn suffer from asthma, sickle cell disease, and lead poisoning more often than other parts of the country. Obesity, diabetes, and high blood pressure. Look at the numbers for the New York City, for Brooklyn, for our zip code. Obesity, 1 out of 3 people in Brooklyn are considered obese. 15% of our patients in Flatbush have diabetes. 36% of our adults have high blood pressure. And looking at all of this, giving you the spectrum of the disease, first 4 weeks is when you have COVID, you're supposed to be better. First 3 months, most people should get better. If you don't get better, then you might have long COVID, but there are people who are having symptoms more than 6 months after the incident of COVID. About 1 out of 3 people will develop this symptom, these long-term symptoms. And it usually happens more likely in people who have severe diseases, who had to be hospitalized, or were on a machine, on a ventilator, breathing machines to help them breathe. People who have kidney problems. In Brooklyn, we have a high incidence of kidney failures in our patients. Or patients who have DVTs, these are blood clots, or they have heart disease. So just to reiterate, to summarize, if I could say a few things, unvaccinated people or people who are infected from COVID are obviously at higher risk of developing long COVID for having those symptoms. There are no tests, a specific test to diagnose the disease, no specific test. But your doctor can take a history, do other tests, and collaborate with you, do the physical examination, and identify and diagnose you with the disease so they can properly be treated. Look at the numbers. Potentially 23 million people in this country currently could be affected by this condition. Most of the people have not been diagnosed with it. Potentially there's 14 or 17 billion dollars loss annually in the country from COVID-related illnesses or people not being able to work. Sorry. The important point, the illness may be misunderstood because it has such a vague symptomatology, because it has so many different kind of symptoms, people may not take it seriously. But if you know of somebody or if you have those symptoms yourselves, I think it's worth speaking with your healthcare provider. These are some of the investigational drugs, medications that are used in similar conditions. So they are being tried on those patients, and I think we have some success with some of those medications. These are some graphs just to show you that vaccinated people do better in terms of not developing those symptoms than the unvaccinated counterparts do. The disease is so important. There are websites in terms of CDC, that's the Center for Disease Control, or New York State Department of Health, that have published the information that you can go to the website to actually read about them, search about them. But very importantly, it is a disease that you should all be mindful of. I'm going to show you a slide here. This is basically from CDC, Center for Disease Control, that has pamphlets for patients to look through and check the boxes to see if you have any of the symptoms, and the advice is for you to go, or anyone you know, to go and speak with your healthcare provider, because you might be able to receive financial help, medical help, psychological help, mental health for such a debilitating condition. At this point, I'll stop here and ask if you have anybody has any questions about this. Yes, ma'am.
If you've been vaccinated, do you still get that long-term?
So if you are vaccinated, data shows that you can still get it, but the likelihood of getting it is less than population that have not been vaccinated. So vaccination is supposed to protect that to a degree. But obviously, if no one gets that disease, the chance of getting this condition would be almost nil. So don't get the disease, monitor, practice infection control measures, wear a mask, wash your hands. If somebody is sick or diagnosed with illness, make sure you avoid being in contact with them. And especially for those people who have diabetes, high blood pressure, heart disease, for example, or the elderly, or any kind of lung conditions, or children who have asthma, sickle cell, for example, they should be watched carefully so that they don't get this disease and they don't develop the condition from COVID-19.